Hi everyone, it's Nigel Giam here, the lead training program director for the St Mary's scheme and course director for Mentor MRCGP. So it's with great pleasure that I've got Gulabi on really to talk about her approach to obviously the very, very challenging RCA. So firstly, Gulabi, congratulations, a score of 180. That's amazing. Well done. You must be very, very happy.
Yes.
Um, so tell us a bit about yourself, because actually you're working full time, but you're also a full time mum to three young children, all under the age of 4, which is probably 3 times more stressful than the RCA. how
Yeah.
how did you do it? There will be lots of young mums out there who's like, how did you do it? What were the challenges, firstly, for you?
Yeah. So absolutely, the childcare was my biggest challenge.
Mm.
I work 3 full days, and for the fourth day is a VTS, so I would have every Wednesday off. Wednesdays is when the kids were in school, so that was our main day to revise and
Right.
prepare. Mainly to do all the preparation for the exam, which took me about a month, and then after that, I started recording once I understood the basics of it, everything.
Okay, so actually a lot of pre-prep work before we actually started recording.
Yes.
Um, so obviously you've talked, I suppose, about time management just in the practical sense of obviously childcare, time management in terms of the preparation. When it came, I suppose, to your actually RCA recordings, how did you get good with your time management? What were some game changers for you?
Yes, so primarily what you had taught me, and I didn't realize this before I spoke to you, was prepping.
Yes,
So priming the
priming.
consultation,
Yeah, yeah,
thinking ahead, and going through all the past medical history, the
yeah,
medications, understanding the condition before I even see
yeah,
the patient,
yeah,
preparing into medical management. Also, having the options open in my head, knowing exactly the medication name, the
yeah,
dose, so that in the consultation it just flows very naturally and smoothly.
yeah,
The
yeah,
decisions that I come up with, so that prepping for each patient and prepping in advance via each medical condition. For example, if I needed chronic management, I choose 3 different conditions: diabetes
mm,
and I'd make sure I was I had thorough knowledge in terms of
yeah.
the medications to start and the doses and all of that. So that kind of prepping allowed me to stay within time limits and
Yes, excellent.
use aids during the
Yeah.
consultation.
Yeah. So we've talked on previous podcasts about the importance of time management. And actually, that relates so much to case priming, to actually being prepared before the patient actually comes in through the door. We've also talked previously, and I certainly, as I was mentoring you, was talking about, showing complicating factors and an angle to your case. I
Yes.
mean, it's not easy, is it? Because you're never going to get the perfect patient that kind of comes in
Well,
through the
no, but
door.
I think what you taught me is that you can find that complicating factor in certain specific consultations that I didn't realize before. So initially, yes, I had very simple cases, and as time went on, as I got closer to the exams, I found it
Mm.
easier to capture those
Yeah, that's right.
complications in cases. And as you said, priming. If I know the background of a patient, if there's anxiety and depression, which a lot of patients these days with COVID do suffer from,
Yeah,
you can put that into the case and allow and expand on it. If there are physical symptoms, the anxiety and depression will inevitably
yeah,
come in, play with
yeah.
that factors, and bring it all together, which complicates the
Yeah,
case.
absolutely. Absolutely. Well, listen, I am so very, very happy for you. And actually, we're all a bit close to home because obviously I taught your husband for the CSA many, many moons ago. So it's so nice actually to be able to help you through this as well. What are the plans after your CCT?
Uh, Probably just go part time and enjoy my time.
And enjoy the kids as well.
Because
Excellent, excellent.
back.
Yeah, absolutely. Well, regards to your husband, I
Thank
hope you guys have a great time over this festive period and all the best for 2023. Thank you so much for coming on this evening. All right, take care. Thank you.
you for your help. Take care.
So huge congrats to Gulabi there. Fantastic score, 180. Under very challenging circumstances with 3 young kids, but still managed to get those cases and still managed to showcase what the RCA is all about. So there's a huge difference between working hard and working smart. Please don't record blindly. One cannot underestimate the power of case priming. So thinking actually about where you are in terms of the patient's narrative, what's happened before they've actually come to see you, because we as examiners, we don't know your patients. So if you can't help us build up a narrative around, the patient, it actually becomes very difficult for the case to be marked and standardized. We didn't just think about clinical challenge, we're thinking about complicating factors to the case that Gulabi has actually highlighted. So do think about what it is that you're trying to showcase. And the concept of the second golden minute, which I teach all my trainees, is a way to really help you with your time management. So thinking about how you're going to showcase that case priming, how you're going to actually follow through on the patient's ice, making sure that we stay close to the patient's ice, and most importantly, that we actually readdress it as we come into the second half of the consultation. Now, complicating factors can really be twofold. They can be when a patient's agenda really conflicts against your own, or if there is a deeper psychosocial perspective which enables you as a ST to manage a situation and a narrative as opposed to just a symptom and a diagnosis. So do think about your complicating factors. Do think about what it is that you're trying to showcase. Do think about your case priming, and do consider joining us, either on the Facebook support group, where I'll be posting lots of tips, tricks in the lead up to all the exams. And also, do have a look at the other interviews with other successful ST3s, and maybe see you guys on a course. Okay, well, listen, take care of yourselves, and really wishing you a very, very Merry Christmas and all the best for success in 2023. Do take care.